Hi, my name's Diego, and I am a prevention specialist with the Alamo Area Resource Center, and today I will be presenting alongside my colleague Jeremy, and we'll be discussing PrEP, why access is important, the nuances behind the medications that are involved, its efficacy, and some financial assistance options and alternatives. Before we can even discuss PrEP as a means of prevention for HIV, it's important to understand why there is a need for biomedical prevention methods in the first place. That need becomes especially important and apparent when we look at local data for Bexar County. This slide breaks down some local statistics regarding HIV cases among different groups of people across the board in Bexar County. In 2018, there was a total number of 6,308 people living with HIV in Bexar County. When we further dissect this number, we see that by sex, 85.4% of all cases were male and 14.6% of cases were female. When we look at race and ethnicity, we see that majority of cases were attributed to Hispanic and Latinx individuals with a 63.6%. While white individuals had a percentage of 16.9 and black individuals had a percent of 14.5. When we look at age, we see that 4.2% of individuals in that 6,308 number were ages 18 to 24, while individuals ages 25 to 34 had a percent of 21.4, ages 35 to 34 had a percent of 21.3%, ages 45 to 54 had a percent of 26.0, and ages 55 and up had a percentage of 27.1%. And so what we can take away from this slide is that in Bexar County, we see that males who are Hispanic contribute to a majority of cases of people living with HIV, as well as individuals who are ages 55 and up. We see that that numbers also increase. On this slide, we see a side-by-side comparison of county versus national HIV data for 2018. The rate of people living with HIV per 100,000 population by geography in 2018 was higher in Bexar County with a rate of 390 per 100,000 than that of the United States. And this statistic further places an emphasis on Bexar County as a hotspot for proliferating HIV cases, and again, it demonstrates that there is a need for PrEP among different groups of people, especially those who are at higher risk for HIV acquisition. So PrEP in its basic form is a pill you take daily to decrease the risk for HIV. You can almost think of PrEP as birth control, except instead of preventing pregnancy, it prevents HIV acquisition. Currently, there are 2 FDA-approved medicines for PrEP, and those are Truvada and Descovy. Both of these medicines are antiretroviral drugs, and both are taken orally via a pill. They are both nucleoside reverse transcriptase inhibitors, which basically inhibit HIV's ability to copy its RNA, the virus's genetic makeup, into DNA. And this is a process known as reverse transcription and requires the enzyme called reverse transcriptase. So one of 2 FDA-approved medicines for the use of PrEP is Truvada. Truvada is a brand name for the combination of emtricitabine, FDC, and tenofovir disoproxil fumarate, TDF. The dosage is 200 milligrams of FDC and 300 milligrams of TDF, once daily with or without food. And Truvada was approved for anyone at risk for HIV in 2012, including adults and children ages 12 years and older who weigh at least 75 pounds or more. Some of the side effects that have been noted in some clinical studies include diarrhea, nausea, fatigue, abdominal pain, and headaches. Because Truvada does have higher dosages of TDF, which is tenofovir, it is also linked to lower bone density health. Descovy, on the other hand, is the brand name for the combination of emtricitabine, FTC, and tenofovir alafenamide, TAF. The dosage for Descovy is 200 milligrams of FTC and 25 milligrams of TAF. Notably, there is less of that tenofovir in Descovy than there is in Truvada, and Descovy can be taken once daily with or without food. It was FDA approved for the use of PrEP in 2019 only for men and trans females. Some of the notable side effects are diarrhea, nausea, fatigue, abdominal pain, and headaches. However, the side effects are marginally less than those of Truvada. One clinical trial that studied the efficacy of the combination antiretroviral drugs tenofovir and emtricitabine, or Truvada, was the AARC trial. This trial was a 2-year double-blind placebo-controlled study, which meant that participants were given identical pills either containing the antiretroviral medicine or a dummy placebo pill. Although roughly 4,900 subjects were initially screened, only about 2,499 participants were eligible for the study. Individuals were HIV negative men or trans females who have sex with men. Subjects were also instructed to take the pill once a day and practice safer sex activities. Participants paid study visits every 4 weeks during the 2-year study, and at every visit were tested for HIV and asked about their sexual health practices, while providing adherence and risk harm reduction counseling. The AARC study found that of the 100 subjects who seroconverted or became HIV positive during the trial, 36 of these confirmed cases were attributed to subjects given the combination tenofovir and emtricitabine pill, compared to the 64 subjects that were given the placebo pill who also seroconverted during the trial. This yielded an overall efficacy of 44%. However, further analyses indicate that drug levels corresponding to daily use are associated with 99% protection against HIV. Some notable side effects during the trial reported by participants were nausea, which was higher in subjects given Truvada, and higher levels of creatine, which were experienced by 2% of subjects taking the medication and 1% of subjects taking the placebo pill.
Thank you, Diego, for your analysis on the AARC trial. I will be going over the Discover trial. Now, the Discover trial was a randomized double-blind study that followed participants in the course of a little over 2 years. They want to study the efficacy of Descovy compared to Truvada. Now, this study had over 5,000 adult participants, with them being men who sleep with men and transgender women who are at risk for HIV. Now, out of these participants, 2,670 of them were taking Descovy, while 2,665 of them were taking Truvada. Now, on the next slide, I will go over the efficacy of Truvada and Descovy, and some of the side effects and some of the findings that were found in the trial. In this slide, we're going to go over some of the Discover trial findings. Now, as far as efficacy, 99.7% of people taking Descovy for PrEP in the trial stayed HIV negative. It's important to note that efficacy is strongly correlated with adherence. And it is suspected that one of the 7 people that were confirmed for HIV were HIV positive prior to the study. 6 of the other 7 weren't necessarily adherent with taking the medication. Of course, taking your medication as prescribed, which is 1 pill a day. So that could have been the reason for the seroconversion on those 6 participants. Now, some of the side effects that were found during the study were 5% of the participants did encounter having diarrhea, 4% nausea, 2% headache, 2% fatigue, and 2% stomach discomfort. I will talk about bone mineral density and kidney function just a bit. I do also want to notate that in this study, 459 participants switched from Truvada to Descovy, with 100% other patients who switched remain HIV free, which I think it's an important key to note because it's rare that we find in studies where the medication was 100% effective, and they had the data to show that with those participants who stayed HIV free, which is great. Now let's talk about a little bit of the renal function. We did find that with Descovy, was with the participants who were on Descovy, there was a 1.8% increase in renal function, while on Truvada there was a negative 2.3% change. So with the Truvada medication, it just shows that it was a little it produced more stress with the kidneys, with the people who were taking Truvada compared to Descovy. So I think that's important to notate as well when it comes to comparing the two medications. Now, with the bone mineral density, it did show that for lumbar spine, that Descovy participants who were taking Descovy had a 0.5 increase in their lumbar spine, while 1.1% of the participants who were taking Truvada had a decrease. Now, as far as hip, for bone mineral density, 0.2% of participants who were taking Descovy had an increase, while Truvada had a negative 1% decrease. How do we get started? How do we get PrEP? Well, first things first, I think knowing what resources are available. So knowing where in your community who prescribes PrEP, where can you get PrEP? So knowing where to go is the first start. Then after you know where to go, making an appointment with a doctor or a PrEP provider or a PrEP navigator, maybe giving you the education, helping you pay for costs or whatever it may be that might prevent you from accessing services, that would be the next step. Then once that's done, meeting with the doctor, a navigator, and assessing risk and sexual history. It's important to know that PrEP is out there, but a lot of times it might not be the best option for you. So it's important to have that conversation with a doctor or a navigator and to make a plan and see if that's the best option for you. So now, once you made that, what's next? What do you expect while being on PrEP? So undergoing testing for STIs, hepatitis C and B, checking kidney and liver function, maintaining quarterly lab work, making sure you're still HIV negative every 3 months is extremely important. And we'll go over why that's important in the next upcoming slides. So then you receive your prescription. What's next? I think what's not talked about enough is adherence with medication, and that being the key to staying HIV negative. Having Truvada or Descovy for PrEP is great, but it's only as good if you take it every day. It's only good if you use it. It's only good if you utilize the medication. So not skipping any dosages, making sure you set yourself reminders or build a routine is probably the best bet and a key factor in staying adherent with your medication. So keeping that in mind is very important as well. Now, on this slide, we're going to be covering something that could be a huge potential barrier for patients wanting to access PrEP, and of course, that's cost associated with PrEP and PrEP services. With insurance, there's a little bit more resources for individuals who need assistance. The first one is there's the Gilead Copay Assistance Program that initially helps people out after getting assistance with their insurance. Then Gilead will offer assistance with the copay card that covers up to $1,700 a year for copays with medication. One thing that's important to note is that the patient would have to use their insurance first to have some kind of coverage before the Gilead copay card will provide further services and assistance. Now, with Patient Advocate Foundation and PAN Foundation, they are, even with insurance coverage, the amount of coverage they provide afterwards depends on the patient's annual income. So the less they make, the more they'll provide. The more they make, the less they'll provide with copays. So there's no set amount that they actually help with. So it all factors with the income of the patient. But they can help up to, I believe, $7,600 a year in copays with medication. PAN Foundation, most of the times they're low on funds, so they're not really a reliable source, but they have funding sometimes, so it's important to check in and see if there's funding available to them. Now, someone who doesn't have insurance, Gilead Advancing Access Program covers the medication at 100% cost, as long as they're below as long as they're below the federal poverty line. So I think, depending on their dependents and stuff like that, if they're just, supporting themselves, of course, then they'll have to meet a smaller amount annually. Now, with pleaseprepme.org, this is a website that offers an abundance of resources depending on the state the patient lives. So they'll just click on their state, and that website offers them a lot of resources, whether they're insured or uninsured, that they will be able to access and hopefully get assistance. Now, with us here at the Alamo Area Resource Center, we do have a 340B program where we offer with assistance for insured patients and uninsured patients. If they're insured and if they're eligible, then we're able to help with expensive copays, like for labs or office visits that maybe they wouldn't be able to afford because they have a high deductible and high co-insurance. Then we would be able to help with assistance with that. Now, without insurance, we cover the cost of labs and office visits for someone who doesn't have insurance, as long as they're enrolled in our 340B program. And of course, if you want further information, you can contact myself, Jeremy, at AARC, or get more information on our website at www.aarcsa.com. So here's a list of other community partners in San Antonio who have providers who prescribe PrEP. I think it's important to know what other resources are out there in the community to give our patients.